Hello friends, welcome to my channel Med Simply Learn. Today I am going to discuss another very important topic, that is Hba1c, a good indicator of diabetic control. So let's start the video. First of all, let's see what is this Hba1c. It is also known as glycated hemoglobin. It is a blood test that reflects blood sugar levels over previous 2 to 3 months. So, as we have just now seen, it is known as glycated hemoglobin. Now let's see what does the term glycation means. It is non-enzymatic addition of a sugar residue to amino group of proteins. So in Hba1c molecule, the sugar residue is the glucose molecule and the protein part is the hemoglobin. Okay. Now let's discuss about hemoglobin. In adults, major fraction is Hba molecule, which is around 97%. Minor fractions include Hba2, which is 2.5%, and Hbf, which is 0.5%. This is the diagram of Hba molecule, which consists of two alpha chains and two beta chains. And in the center, we have four heme molecules. After a brief introduction, let's see how this Hba1c is formed. What happens is this adult hemoglobin, which is the main Hba molecule, undergoes condensation with glucose molecules when they are present in excess amount in the blood, and these glucose molecules get attached to the N-terminal valine of the beta chain. These are beta chains and N-terminal valine. These glucose molecules get attached and form a molecule known as Schiff's base. This Schiff's base is also known as pre-Hba1c. Now, this Schiff's base undergoes a rearrangement known as Amadori's rearrangement to form the Hba1c molecule. Once this formation occurs, it is an irreversible molecule, which means that Hba1c, once formed, will remain throughout the lifespan of that RBC. So we can see that concentration of Hba1c depends on two main factors. One is the lifespan of RBC, which is around 3 to 4 months, and the concentration of glucose in blood. Okay, so this was about how Hba1c molecules get formed. Now let's discuss the importance of Hba1c levels. So first importance is it helps in monitoring the long-term glycemic control. How? Since it tells us about the average glucose levels over the past 3 to 4 months. So if we keep on repeating the Hba1c every 3 months, we can get a fair idea about the glycemic control. Secondly, it helps in monitoring the response to therapy and adjust treatment accordingly. Suppose we have started any anti-diabetic drug in a patient, we can do a baseline Hba1c, and after 3 months of the therapy, we can again repeat the Hba1c levels and see the effect. If the control is adequate, we can continue the treatment, or if it is not adequate control, we can increase or adjust the dose accordingly. And lastly, it helps in predicting the risk for development of complications. Now, let's discuss about this long-term glycemic control further. We see that patients who are undergoing treatment, 30% of patients are able to achieve Hba1c levels less than 7%. That is, they have optimal Hba1c control. While 40% of patients having treatment, they have their Hba1c between 7 to 8%, which means they require monitoring of the Hba1c levels. And remaining 30% patients struggle with Hba1c over the 8%, which indicates that these are the high risk patients for the diabetic complications. Now we shall discuss Hba1c's if correlation to the various diabetic complications. So what are the diabetic complications? They include diabetic retinopathy, diabetic neuropathy, stroke, diabetic cardiomyopathy, and diabetic nephropathy. All these complications of diabetes are more closely related to the Hba1c levels rather than the plasma glucose levels. Coming to Hba1c testing methods. So most common methods are HPLC and immunoassays because both these techniques offer better precision in measuring the Hba1 levels. Other methods are like affinity based methods, chemical methods, electrospray iontophoresis, etc. Now, Hba1c levels or the reference range which we generally follow is less than 5.7 is considered as normal Hba1c levels. If the levels are between 5.7 to 6.4, we consider it as pre-diabetes and risk is increased in these patients. And if the levels are more than 6.5 or equal to 6.5, then the diagnosis is diabetes and risk for complications in these patients is high. So now let's discuss American Diabetic Association recommendations for Hba1c levels. The general targets are less than 7% for all the adults, while these targets are little bit relaxed in patients who are having comorbid conditions or long-standing diabetes or limited life expectancy. Here the criteria is less than 8%, while if it is a short duration of diabetes or longer life expectancy, then more stringent criteria is to be followed, and there the criteria is Hba1c level should be less than 6.5%. Coming to the advantages of Hba1c levels over the plasma glucose level. First and foremost advantage is Hba1c levels are unaffected by exercise or food ingestion. Secondly, convenience for the patient. Hba1c level sample can be given easily because no fasting is required, can be given at any time of the day. While for plasma glucose fasting is required and sometime patient has to be fasting, so sample has to be given early morning. Third important advantage is Hba1c is stable after collection. Values do not change in the sample if the sample is handled properly, while glucose levels tend to decrease. Thus, stability is an issue with measurement of plasma glucose. Again, unaffected by stress or illness. Okay, and finally, it has been seen that day-to-day variation is less with A1C values than the glucose levels. This variance is only 2% for A1C but around 12 to 15% for plasma glucose. So these are the advantages. Now, let's see the limitations of this test. Any condition which affects RBC lifespan like hemolytic disease or other conditions which like sickle cell anemia, pyruvate kinase deficiency, all these conditions where the RBC lifespan is affected, decreased Hba1c levels are seen, which can lead to misclassification. Any condition that changes red cell turnover like hemolytic anemias, blood loss or blood transfusion can also affect the Hba1c results. Then iron deficiency anemia. Here there is high proportion of old erythrocytes, so they can also affect the Hba1c values. Certain variants like sickle cell anemia or HbF, fetal hemoglobin, can spuriously increase or decrease the results of Hba1c depending upon methods of analysis, which can lead to misdiagnosis. Also, we have seen that A1C levels appear to increase with age. So, targets should be age related, not generalized. And finally, ethnic variation is also observed in Hba1c levels at same glucose levels. They may be different for an African origin person, different for an American or a Asian origin person. So these are the limitations of this test. That was all about Hba1c. I hope you liked the video. Thanks for watching. If you liked the video, do subscribe to my channel and share this video. And also in the comment section, please let me know what next you want me to discuss.